Many women think I'm only having sex with one partner, I'm not at risk, I'm safe. Is this a dangerous assumption?
You may only have sex with one person, but you can get cancer.
The question nobody is asking, how does sex lead to cancer?
1/3 of them became HPV positive. The boys have more than one partner.
Cervical cancer is a common cancer in Malaysian women.
This week, we sit down with Dr. Chu, a gynaecologist who specialises in female reproductive cancers, backed by decades of clinical experience and training, holding advanced medical degrees from Australia and Scotland, alongside prestigious fellowships in London and Singapore. She is here to reveal the reality of cervical cancer and how we can prevent it.
The world is on a mission to eliminate cervical cancer.
How long does the HPV take to become positive? So from the time of being infected
Yep.
to actually becoming cancer, you've got a window of 10 years. Would you say it's legit to also get our sons to vaccinate?
So a lot of people will not go for screening because past experience is painful. Or you could do something called
Dr. Chu, many women think I'm only having sex with one partner, I'm not at risk, I'm safe. Is this a dangerous assumption, and how true is it that cervical cancer only happens to women who have sex with multiple people? And actually, what is cervical cancer?
Okay, all right. So cervical cancer is difficult to understand because it's not something that you can see. Okay, it's not a body part that is visible, so most people don't know about it. All right, but it exists. It's the entrance to the womb, and it, like every part of your body, it can turn into cancer. So for a long time, when we're studying disease, we collect information. We collect information from women to see what is the common factor that they have that makes them have cancer. Okay. And sadly, the initial information was always people who had children early, people who had sex early, people who had multiple partners early. So it became quite a connotation, if you like, okay, that, you know, if you are promiscuous, then you will get cervical cancer, okay? But actually, you may only have sex with one person, but you can get cancer, okay? And they proved this by showing by a study. Okay, so we now understand that cervix cancer is caused by a HPV infection. So HPV stands for human papillomavirus, and the infection is acquired through genital contact. Okay, all right. So they were trying to find out. So like this assumption, I only have sex with one person, so I'm not going to get cancer, right? So they did a study in university. Right, and all girls who have one sexual partner were enrolled. Okay, so they were all negative for HPV. All right, so they were enrolled, and they continued to have only one partner. Right, but they get kicked out of the study the moment they break up with this partner and go on to somebody else. Okay, because they want to see one single partner. And would you believe 1/3 of them became HPV positive? And the reason is, the boys have more than one partner. We're controlling the girls.
Right. So
Okay.
the girl's not promiscuous, but the boy is.
Yeah.
And that's how the HPV spreads.
Yeah. Okay. And also, the girl may not be the boy's first partner. So they may already have the HPV. And then the HPV takes time to become positive.
How long does the HPV take to become positive?
Actually, majority people who test negative have actually been infected.
Okay.
Okay, but you have to have a certain amount of virus in the test for you to be considered positive. So what they have, the level where it's positive is what we call clinical significance. That means you have so many copies of the virus where we think you may develop an illness.
I see.
Okay, so it's a little bit like COVID, right? Okay, so during COVID, people will say, I feel so unwell and my test is negative. And tomorrow I do the test and it's still negative. And I feel really, really shitty. And then I do the test and it's positive. Why? Because the level of the virus numbers goes up.
Right.
It reaches a significant level.
Yep.
And then it becomes positive. Okay. So all these women who say, oh, I'm clean.
HPV negative.
Yes, I am wonderful. My partner doesn't sleep around. Actually may not be true.
So it's just a matter of time.
It could be. Yeah.
Could be.
It could be. Or just that your defense system is so good that actually you keep the level down.
I
Okay,
see.
so it may never affect you.
Right. You've explained how sex actually leads to the risk of cervical cancer for women.
Yeah.
And you mentioned before genital contact. Does that mean that you don't actually need penetration to be at
True.
risk of cervical cancer?
Yeah, true. So actually people think that if you have a same-sex partner, so if you're a woman, well, your partner is female,
Right.
that you will never get HPV, okay, and therefore you don't need screening, okay? And that was a problem like in countries where they have organized screening, where they will always ask, have you had sex? And the girls who have sex with the same-sex partner will always say no, right? Okay, no sexual penetration. They didn't get screened, they got cervical cancer. Okay,
see.
all right. And part of the reason could be, again, this dilemma of your partner having more than you as a partner.
Right.
Okay, so they could have
The
had
history.
their history. They could be heterosexual before,
Right.
and then they acquired, and they have, and then they pass it to their female partner.
Nice.
Okay, and now I have had patients who are positive, all right, and then they feel really guilty because they passed it on to their partner, the female partner. Okay, so actually, genital contact is what we should be asking, not so much have we had sex.
Sex.
Okay.
That's right.
Yeah.
So genital contact.
Okay, because the HPV virus is found in your anus, it's found in the vulva, it's found in the vagina, and then in the cervix. So it's just that whole anogenital area.
But that means that if you've never had sex, then you wouldn't be at risk of HPV cancer. Is that fair to say?
Correct. Yeah, it is. Okay. So again, there are girls who've gone for health screening tests, and they have pap smears and HPV tests and everything. And then they come to me for follow-up. They've had negative tests, right? And then they come back 2 years later and they say, I want to do a health check. Can you check me? And I said, so I go through the questions and never ever have sex before. And I said, well, you don't need a pap smear, so we just need to do an ultrasound scan if you want. And they would say, but I had one done. And I said, but why? And they say, well, the doctor says, since you're here. Okay, so actually, in some ways, there's a lack of understanding in the general public, but I think also sometimes a lack of understanding in the medical profession, as to who you need to screen. Okay.
So we need to be screening anyone who has had genital contact.
Correct.
Now, I went to Dr. Google, if I may, knowing that I was going to see you and have a chat today. And what shocked me was, with the information online, cervical cancer is actually the third most common woman cancer in Malaysia. That's pretty high numbers, right? And second most common for women, ladies aged from young to middle aged. What's the youngest cervical cancer patient you've actually seen? What sort of story is there to that?
I think my youngest patient will be in the early 30s. Because actually, generally, it's a disease of the young. Okay, so there are two peaks. Okay, you get peak in the young sexually active women. Okay, and then it seems to go down, and then you have another peak in the elderly women. Okay, so the elderly, but this is data going back maybe about 20 years. Okay, so the elderly women were this group of women who never ever went for screening because they never knew anything about screening. Okay, so they're the older group. For the younger group, my youngest patient, if I remember correctly, in the early 30s. Okay, but the very youngest patient who is famous, if you like, okay, is under the age of 25. Okay.
That's young.
Yeah, very young. Okay, so she was a reality TV star. Okay, and UK had changed their screening from the age of 25 to 30. Okay, from the age of 20 to 25.
Right.
Okay, because they thought that actually if we screen too young, we end up treating too many people who are never going to get cancer. Right. So then we make them at risk of having problems in their future pregnancy. Okay, so they changed the age. And of course, lo and behold, Jane Goody got diagnosed with cancer at age 24. So there was this major hue and cry outside the Ministry of Health saying, why on earth did you do that? Right? So see, you could have picked this up. But the reality was, she did go for screening and she never followed up on the abnormal smear. Okay, people called her to come for treatment, and she never came. Okay, then she had abnormal bleeding, and then she never went for treatment. Okay, so we believe that it takes about 10 years for HPV infection to lead to changes in cancer.
I see.
Okay.
So from the time of being infected
Yeah.
to actually becoming cancer, you've got a window of 10 years.
Yep.
So that's quite a bit of time for screening, isn't it?
Yes.
But before we go on to screening, let's talk about the vaccine, because from what I understand, you have a vaccine that can actually protect you from the HPV virus,
Yeah.
which means you pretty much prevent it from having cervix cancer. I mean, that sounds a bit too good to be true, isn't it?
So we are very fortunate because in terms of cervical cancer, we have basically unraveled the history, the mystery. Okay, we know what causes it. We know how it developed. Okay, and then because we know what caused it, we can target it. And so, like you say, vaccine. Okay, so we have recognized initially that there were 14 types of HPV that cause, so 14 strains, okay, that lead to cancer. Because in total, there are over 200 strains of HPV.
But then the 186 don't lead to cancer?
They affect different parts of our body.
Right.
Affects animals. Okay, different things. Okay, so actually, we used to think that this HPV was so clever, like in different parts of the body, they behave differently. But then somebody unraveled it. Harold von Zuhausen, he unraveled the entire mystery, the entire DNA of this virus. Okay, so we come to realize that they're all actually different. Okay, so initially they classified 14 of them that they can be, if you get infected, it causes change in the cells, you can develop cancer. Okay, but not all of them have the same kind of danger, or if you like. Okay, so we know there are two types, HPV 16 and 18.
Okay.
They cause 70% of the cancer worldwide. Doesn't matter where you stay in Australia, you stay in Europe, you stay in Asia. HPV 16 and 18 will still cause the majority of the cancer.
Right.
Okay, so a lot of research was centered on this, right? We also know that there are another 10 that can, okay? In fact, then we thought there were another 12 that could cause cancer, okay? So to try and develop one vaccine that will cure, that will
take care of
help you, it's difficult, okay? Because you have to target the sensitive area of the virus so that you can destroy it, okay? So they concentrated mainly on 16 and 18, okay? All right, so the initial wave of vaccine, okay, two of them, they were targeting 16 and 18, okay? And so we have another 12, or now we say there's another 10, okay? So if you vaccinate yourself, you're protected against these two, but not the others, okay?
That's mind-boggling. So you're saying when a woman gets vaccinated for HPV, she's protected for 16, 18, but there's another 10 viruses lurking around.
That's right.
Another 10 strains of HPV.
Another strain, yeah. Okay, all right. Okay. But then there was more effort to develop newer vaccines. So the
broader
second,
coverage.
yeah. So the second one managed to protect you against 7 strains. Okay, although it's called Gardasil 9. I know I'm not supposed to advertise this, but this is the only vaccine we have, right? So we have a couple called Gardasil 9. Okay, but it only protects you against 7 of the high risk HPV. Okay, the other 2 they cause genital warts. They don't cause cancer, which is just as troubling. Okay, so if you vaccinate your children yourself, you get protected against the 7. Okay, so they are responsible for 90% of the cancers collectively. So I think that's a pretty good number. Okay, but we know that actually that won't do all the work. That's why we have to marry vaccination with screening. Okay, you cannot rely entirely on vaccination. Okay, and sadly, that's the message that's going out. Okay, you've been vaccinated, you're okay. All right. So when patients sometimes come to my clinic, I say, okay, I want to offer you the HPV test, and the first answer will be, but I've taken the vaccine.
They're vaccinated. They're covered for 90%. I mean, their risk goes down by 90%.
Yeah.
Is that right? So you're saying the testing is for the 10%?
We test for all of them, okay? Because depends on when you get vaccinated, right?
Yeah, depends on whether
school
you-
kids,
Mhm.
hopefully they've not had sex yet. When we vaccinate them, they are HPV naive, okay?
Okay.
So they are completely protected as
Alright.
far as we know,
Alright.
okay? But some women would have their vaccination after they've had sex.
It
She's
doesn't work
okay.
anymore?
Yeah, it can still work.
It still works.
Okay, right? But what you had before, you already have it.
Right.
Okay? So it protects you against future exposure.
And what happens to the HPV that you already accumulated
You have it.
with the sex before vaccination?
You have it.
So it's lurking in the background?
Yeah. Your vaccine does not kill this virus. Okay? So people can still get HPV disease, right? Even though they get vaccinated. Okay? And that's what people need to understand, you know. And occasionally patients will say, oh yeah, my HPV test is positive, so I've been given the vaccine. And I say, well, what happens after that? You know, did you get examined? Right? So that's really scary because I think that people need to have a better understanding about what all this can do. And it's sad because there's plenty literature going around. But then I put it to you, how often do you read this literature?
Not really.
Right? You go and see a doctor and they say, here, have this, and
All the pamphlets.
yes. And then you take a
Go to the end back, and then it goes to the shelf.
Yeah, and then it gets recycled.
Yes.
Right? So we never read, you know. Yeah.
Yeah, when you talk about screening, let's jump to screening because you speak a lot of about HPV testing. But right here in Malaysia, when I'm with my middle-aged lady friends and we're having a cup of coffee, what I often hear is pap smear. Hey, you've done your pap smear.
Yeah.
You know, what's the difference between pap smear and HPV testing? Which is more relevant?
Okay. So we all know pap smear is cervix screening.
Right.
Okay. So it's like a brand.
Mhm.
It's like Colgate is toothpaste.
Okay.
Right? We forget about Oral-B and everything else. Right? Dali. Right? They've been around for ages, but we forget that they are toothpaste. We remember Colgate. Right? So for a lot of these women, even though they may have had the HPV testing, but to them it's called the pap smear because that is synonymous to cervix screening. Okay? All right. So pap smear is the test that we've had since the 1940s. Okay? So it is a test that involves collecting cells from the cervix. And actually, our aim is not to look for cervical cancer, it's actually to look for pre-cancer changes because that's what we want to pick up so that we can treat it before it turns into cancer.
Okay.
Okay? It is a good test. It is a really good diagnostic test. So what it means is that if we see abnormal cells, you have disease.
All right.
Okay? So it's very specific.
And then you need investigation.
Then you need tests, investigation, treatment. Okay? But you have to wait until the cells change, okay? And sometimes through sampling error, okay, the transfer error, okay, the error of reporting, okay, we miss the cells, okay? Because we're talking about a bunch of cells that is going to be put on the slide, right? We miss a lot of them. The old-fashioned pap smear involves taking a wooden paddle, collecting the cells, and then transferring the cells onto a flat glass slide.
For the benefit of those who have never done pap smear and they're listening to this, where is the wooden pedal going?
It's going into your cervix,
Yeah.
okay? And then it's rotating it twice, okay? So you've got a wooden pedal that is like an ice cream lollipop stick, okay? And then you're transferring the cells onto a flat slide. Do you know where most of the slides end up? In the rubbish bin. Because it's impossible to transfer all the cells onto the slide.
Right. So
we miss
fraction
we
goes
miss
the slide.
things, okay? All right, so that's one of the sampling error, okay? We're talking about reporting error, right? We're looking at kidney cells mixed with mucus, blood cells. Sometimes we miss things, right? Okay, I used to think, how can you miss it, right? Until I went to look at the slides and they're awful because everything's stuck together. So, you know, a lot of kudos go to doctors who read the slides. Now we have a better test called liquid-based cytology, which is also a pap smear, collecting the cells using the brush from the cervix, transferring into a liquid medium. They collect the cells, put it on the slide, monolayer, easier to read, okay? But it's still, we miss things, okay? So, pap smear is supposed to be done every 3 years. That is how frequently you're meant to have your cervix screening. But you and probably all your friends, you all have it done every year.
Right.
Yeah?
Yes. It's often
Why?
said, isn't it?
Yeah, why? Because we're so worried we might miss things. Okay? All right? So therefore we do it every year. So we still use the pap smear a lot, okay? But we use it for different reasons, okay? So now screening has shifted, and it is not just in Malaysia, it's worldwide, okay? It's a recommendation for WHO, the World Health Organization, right? That we should have a better test, okay? Because, we've been talking about HPV, okay?
Yes.
We know HPV causes the changes in the cells that lead to cancer. So we found a test, okay? We can test for the presence of HPV, okay? We can test for all the 12 that causes cervical cancer.
All the 12.
Yeah. And one test for all 12 subtypes, okay? And what it does is it tells us, as I say, the clinical significant night, okay? If you have so many copies, you're positive. You have less, it's negative, okay? This test is read by a machine.
The
Okay.
HPV test.
Test,
Right.
right? It's collected very easily. You just put a swab in, you collect, and it's just into the vagina. You don't have to find the cervix, okay? You put the swab in the vagina, you collect the cells, you put it in the machine, okay? And it will tell you it's positive or negative.
So
Yeah.
you're saying it's easier to actually collect it in the procedure, and once it's in the machine, as opposed to the pap smear that's being read by a human, your margin error drops.
There's no we take away human error, okay? The machine also tells you if you don't collect any cells, because imagine you collect something and there's no cells,
Right.
and it comes back negative. The machine will tell you that you haven't collected any cells, right? Because they have a control which is looking for human cells. Okay, so if there are no human cells, your test will be invalid.
So it's the case of machines being smarter than humans.
Oh, definitely. Okay, so
Right.
here we go. We don't have error. Okay, we have positive, negative. So the test has been available, but people didn't really know how to use this test.
Okay.
Okay. So commercially, it has been around for a while. Okay. And in countries like UK, you're not allowed to use it because you don't know how to. We don't know the relevance of this test.
Right.
Okay. So after testing, I would say millions of women. Okay. Right. Because there are so many countries that we're testing. They realized that actually, if you have a negative test, right, your risk of getting cervical cancer is less than 1%. Less than 1%.
Right.
In 5 years. Okay, right? So you have one negative test. It doesn't mean that you definitely don't have the virus, but it also means that if you have the virus, you were able to clear the infection, keep the infection at bay. All right. So therefore, your risk is so low, and we know that it will stay low for 5 years. So therefore, we can safely, confidently tell you, Pauline, you don't need to have another test for 5 years. Okay? Contrary to the pap smear where everybody is so worried that we might get it wrong. So we keep asking women to come back every year.
Right.
Yeah. So, if you have a test that is going to miss 1%, okay, or you have a test that, you might miss 50%, which one would you choose?
It's a no-brainer.
Yeah.
Let me ask you then. I'm walking into your clinic today, Dr. Chu. Would you then just simply do just a HPV test on me?
Yes.
And you wouldn't ask me to do the pap smear unless, I'm positive.
Correct. Okay, so this is for screening. That means you've come to my clinic and all you're interested is whether or not you have cervical cancer. Okay? All right?
Yeah.
So I'm screening somebody who has no symptoms. Right? So I would just do a HPV test. Okay? If you come in and you say, I have abnormal bleeding, for some reason, even when I'm not having my period, I'm still bleeding, then I'm more worried. I would do both. Okay? All right? But I could also just do one and wait to see if it's positive. Okay? So the screening has evolved. Okay? The recommendation now is we use the HPV test as a triage. Okay? We see what your risks are. And then we do the definitive test. Do you actually have the disease?
Tired of doctors talking and not understanding what you're saying? TalkHealth Asia cuts the fluff. Real experts, real answers, real access, so you can take control of your health. Does that mean that if, for pure screening meaning no symptoms for the viewers, does this mean that a woman who has no symptoms, just screening, would, in your view, not need a pap smear ever? And this HPV testing is less painful, isn't it?
Okay, so there are several ways to test for HPV.
Yeah.
Okay. You can collect HPV in the same way that you did a pap smear. So you still have to have the speculum inserted into the vagina to look for the cervix, and then collect the cells or the secretion from the cervix, and then you do the HPV test. Okay. Or you could do something called self-testing. Okay.
The woman does it herself.
Yes. Okay. Which means you have a swab, and on the swab, there is a little indicator how far into the vagina you need to put the swab. Okay.
Right.
And then you rotate the swab. I think it's 3 times. Right.
Okay.
And then you put it into the gel-based thing, and then you give it to the nurse. Okay. So this is something that happens in KKM clinics. Okay. When you go and you don't have symptoms or you're there for screening, you do the test yourself.
So KKM will issue you the test kit?
They give you, when you go there, no, not KKM, but the LPPKN clinics,
Right.
all these clinics that you go to, right?
Okay.
They will just give you the swab, and you give it back to them.
Okay.
They take a note of your contact details, right? And they will call you if there's an issue. They will arrange an appointment for you to the nearest public hospital if it's positive. Okay? All right? So why do we do this? Why self-testing? Right? Because a lot of people will not go for screening because past experience is painful. They've heard from somebody it's painful. But they've never been. Okay? All right? So, and sometimes it's just culture, religious beliefs, culture. They just don't want to be examined by a male. Okay? All right. So when you introduce something like this, and this is robust, it's a robust method. Okay. It's been tested. It's just as effective as if a doctor takes it. If you do this, you're going to increase the uptake of screening. Okay. And this is the basis of this big NGO foundation called Rose Foundation. Okay. It's actually trying to overcome the barrier of screening. So they were the ones that took it out to the population and say, do it yourself. The test is accurate. You know, it's good.
How popular is this test? Like I don't think I've heard of many people taking up this availability.
In the KK clinics, they're now all offered. Okay, it is rolled out. Okay, it actually started rolling out in 2019, but then of course the pandemic happened, and then all the machines that we used to analyze went to analyzing COVID.
Okay.
Okay.
It's the same machine.
Same machine. Okay. So then it took a back step. Okay. So it started 3 or 4 years later.
Right.
And then it started in pilot clinics, and then it's being rolled out. Okay. All right. So actually most of my patients who come to me ask, have you had a pap smear or have your cervix screened? And they go, yeah, I went to the KK clinic. So then I will ask, did you do it yourself? Did the nurse do it for you? And they will all say, I did it myself. So then I know what test they had done, you know, right? So actually it's there, okay? But for most people who go to GPs, actually I have to say that a lot of the GPs now, they actually offer a combination, pap smear and HPV test.
Okay.
Okay, all right? Possibly the ones who go for talks to upgrade themselves, okay? But surprisingly, quite a lot of gynecologists don't do it. And I cannot understand.
Right.
I have no idea.
So because my friends who see, a lot of them who see gynecologists continue to do pap smear rather than HPV testing.
Yeah. I'm skeptical, but I won't go into that.
I understand. But in terms of discomfort, as I understand it, the HPV testing, in my experience anyway, HPV testing is less uncomfortable than the pap smear.
Yeah. Because it can be done with a swab. Okay. If I don't have to examine your cervix, there's no need to put the speculum in. Okay. And so quite often I will offer the patient, I'll say, you could do it yourself. And mostly they will say, I'm here, you might as well just do it. Right. Okay. So then they have the reassurance that somebody's looked at the cervix and it looks okay. All right. So, I would often just do the thing, and if they don't like to examine, then I will not look at the cervix. Okay. But, generally they come to the gynae for a reason. Okay. They want to be reassured. So I would offer it to them. The pap smear feels scratchy. Okay. Because the brush is scratchy. Right? Okay. But it's not the end of the world. It's not bad.
No.
Okay.
And it's very quick, I have to say, on camera.
But sadly, a lot of people don't want these things because their friends have told them it's the worst experience on earth.
Right. No.
Just like the mammogram.
Yep.
The worst thing. And I said, have you had one? No.
The rumor and the anticipated suffering is always worse than the actual experience, isn't it? Yeah. And with this examinations, right? I mean, in terms of religious concerns, especially for young girls, would HPV testing in that swab breach any religious concerns?
No. Okay. So actually, screening starts, as I say, age 25. Okay. So that's also universal internationally. Okay. So, but between the age of 25 to 30, okay, if we follow the UK and the Caucasian trend, we believe that that's when people are most promiscuous.
Right, 25 to 30.
Yeah. Okay.
Right.
So therefore, you're going to most likely be HPV positive. Okay. But you're not going to have a disease. You're just HPV positive, but you most likely will clear the disease. Okay. So between the age of 25 and 30, okay, we do pap smears. Okay. Because we only want to treat people who have disease.
Yep.
Okay. All right. Because even if you're HPV positive and you actually have a precancerous disease and you're young, your body has the ability to reverse everything. Yeah. Because it doesn't mean that actually you have the virus and the virus has caused some change. Okay. But it's not cancer. Okay. Right? There's a possibility for the body to reverse the thing back to normal. Okay.
I see.
So I think the concern when HPV testing came out was that are we going to overtreat patients? Now, are we going to treat every single person who is HPV positive and then we end up shortening their cervix and they have problems in future? And the answer is yes, there's a concern. Okay, which is why it is important that as gynecologists, we all go and update ourselves so that we understand this better, so that we don't overtreat. Okay, but by the same token, we are also very scared of patients not coming back for follow-up. So we lose the opportunity of treating them before they turn into cancer. Okay, so it's a balance. Okay, it's a real balance. So these things take a lot of time to explain. Right? So you sit and you explain and you form a kind of rapport with the patient, right? And if you think she's going to come back, right? She will come back because she's sufficiently worried. She understands what I'm saying. She knows why she needs to come back. Then you can get away with that biopsy, make sure everything's okay. There's no cancer, right? And then you give them a follow-up appointment. But if you're talking to somebody who, they're really, really not interested, or you think this one definitely won't come back, you're better off treating them. Overtreat, get it sorted once and for all. Okay.
Right.
So,
And when you speak of running this pap smear because of this age 25 to 30, but apart from screening, what sort of symptoms would worry a woman enough to show up in your clinic, or they should show up in your clinic?
That's the problem. They don't have symptoms.
That's a scary part.
Okay. Because remember, this is screening. Okay. We're finding this through screening. Okay. So they don't have symptoms.
Most women don't actually have symptoms.
Correct. Yeah. The ones who have the symptoms, they've already got cancer.
Right. So it's kind of like few stages, right? You're talking about HPV infection. It takes 10 years to become abnormal cells. That's which.
No. 10 years to become cancer.
10 years to become cancer. Abnormal cells will appear in that 10 years.
Yeah.
And symptoms don't happen till the cancer starts.
That's why a lot of us feel that it's a bit of a crime in this day and age for people to get cervical cancer. We have the vaccine. We have screening. We have opportunity to treat before they become cancer. And then people get cancer. But the good news is cancer numbers are going down. Okay, they are going down. Okay, through vaccination, cancer numbers are going down. Okay, and that's been demonstrated. So, vaccination came about 2006. Okay, and by
In our country?
no, in other countries, we started vaccinating 2010
2010.
Yeah.
In schools, isn't it?
in schools. Yeah. Okay.
Mhm.
So by 2018, 19, there were publications to show that actually pre-cancer has come down, cancer has come down.
Right.
Yeah.
And it's not this vaccination is not mandatory in schools, is it?
In Malaysia, we actually have very good uptake of the vaccine. Okay, because in Malaysia, it is a national vaccination program. Okay, so therefore, everybody gets offered it if you're a girl in school. Okay, basically the girls go home, ask the parents to sign a piece of paper. Okay, all right, and most parents would just say, free vaccine, sign a piece of paper. Okay, some will have this reservation about what vaccine does to the body. Okay, so those are the ones. So it's an opt-out program.
I
Okay,
see.
so the majority will have it. And the strange thing that I find with our girls is now they are all in the 25, 26.
Because it was rolled out.
Actually more, there must be about 30, right?
Okay.
They come into my clinic for other things. And as a routine, I was saying, did you get the vaccine at school? And they go, I cannot remember. I said, somebody stabbed you 3 times and you cannot remember.
Oh, so it's just in 3 dosages.
At that time, when we first started, it was 3 doses. Okay?
And now?
Now it's 1 dose.
It's now 1 dose.
Yeah.
Okay.
Now it's 1 dose.
And this injection, whether the 3 doses, now the 1 dose, it covers the 16 and 18 or it covers the 7?
I think the ones in school cover 16 and 18 only. Okay. At one point, so the initial vaccines that we had, the first generation, we had a vaccine called Cervical and we had a vaccine called Gardasil.
Right.
Okay. They both tended for school programs. Okay. The first group got Cervical. Okay. And because it was cheaper. Okay. And they did the job. Okay. So Cervical was being used. Okay. And then, every time the tender comes up, people talk about it and then they say, but why are we not just doing Gardasil? Because it also protects against genital warts, which is a major problem. So therefore, they started buying Gardasil. Okay. So now this one covers 6, 11, 16, and 18. Right. So still only 16 and 18 that cause cancer. Okay. And then, so they started vaccinating. Right. It's slightly more expensive. Not that much more, but slightly more. And then they realized that this stock was going to expire.
Okay.
So we'll go back to 16 and 18 Cervical again. Okay. So I think that was like this jump in between. Okay.
I see.
But since post-COVID, right, we've been doing 16, 18.
I have 2 questions about that. If a girl was vaccinated back in school, 16, 18 covered, can she now, as an adult, at 30,
have the new one?
Have the new one that has a broader coverage? Would it be like over-vaccinated?
No.
Over-vaccinated?
Okay. You can't over-vaccinate because the vaccine does not have the virus.
Right.
Okay. The vaccine has the shell that is genetic, that is engineered. Right. It doesn't have the virus. Okay. And they behave in different ways. Okay. How you respond to the vaccine. Okay. So yes, you can.
And does the vaccine work for all ages of women?
So far, yes. Okay. So I remember trials going on to women aged 50 plus.
50 plus?
Yeah. And they still demonstrated a response.
Right.
Okay. When I say response,
Yeah, I
it
was
means
gonna
they
ask
converted the antibodies. Okay. So when you do a trial, they collect your blood and then they will go and check to see the antibodies. That's how they measure it. Okay. But on a normal basis, if you had a vaccine, I wouldn't say, go and check the blood. Not like hepatitis, right? Okay. So we'll say, go and check and see whether you seroconvert. Because actually, the seroconversion rate is like close to 100%. Almost everyone who got it seroconverted.
I see.
Yeah. And it's safe.
I was going to
Very,
say that.
very safe. Okay.
Surely there are side effects
No, actually, side effects like what you would expect: painful arm, okay,
Yeah.
a fever. Some people say they have a bit of diarrhea, but generally it's safe.
Was there a concern in some Asian country where the program was paused a little while?
There are always program. So Japan was one of them. They
Yeah.
paused the program.
Mm-hmm.
Now they're regretting it because the cervical cancer rates are going up. Okay, so it's actually quite difficult for them to reinstate the program. So I'm not quite sure what they're doing.
Okay.
Okay.
Was the concern legitimate?
No. So there is a scientific body, okay, that actually monitors all vaccines,
Okay.
that look for safety,
Yep.
okay, and every time anybody reports what they consider a side effect of the vaccine, it has to be investigated, okay, and it is safe. It is actually very safe. There's been no adverse events, okay. If you Google. Like most people do. If you Google, you will find
these days.
You will find, okay?
Yes.
So the first vaccination program in UK, somebody got vaccinated, she died the next day, right? So big event, media event. But the mother actually came forward and said, my daughter died of heart disease. She has heart disease. It is not the vaccine. But nobody reads second-day newspaper. Yeah. Nobody reads second-day newspaper. In Africa, they went on a massive screening thing. People donated vaccine. They flew all the way there, give the vaccine, and vaccinated the first girl, and she had a fell and fainted. And I felt it was a bit strange, okay? But I did a second one, same thing happened. So the third one, same thing happened. And I thought, oh God. So they stopped the vaccination program. They analyzed the thing to see whether anything had, the travel had destroyed the thing or anything. And they checked the girls, nothing, right? Absolutely nothing. And then finally they got the psychologist in, and the diagnosis was mass hysteria, okay? So one girl reacted badly, and the second one saw the first one doing this, so she did the same, and the third one, because to these people, they have no idea what we're doing to them.
I see.
Okay, all right? So how do they do this? They put them in separate cubicles and then they vaccinated them.
And the problem went away?
Yes.
Wow. That's mind-boggling.
Okay. So if you Google, you'll find it.
To get this now in a private setting, in a private clinic or private hospital, how much would a vaccination cost? Just a range. I know it would differ from place to place.
Individual ones cost over 600 ringgit. Okay.
Right.
So the triple thing is less than that. Way less than that.
Right. So each one's about 600, but you needed 3 doses, or the 3-in-1 would be a bit less.
Yeah.
I see. And what about the HPV test?
The HPV test in most hospitals will cost about 200 plus ringgit.
And a pap smear?
Close to 100, if not more.
Right.
Okay. So it's false economy. You say, oh, this one's cheaper, but then you have to do it annually.
Yeah.
Okay. Whereas if you do a test that costs 200 plus ringgit.
But then it's once in 5 years.
And if it's positive, you must see it as it's a good thing that we pick it up.
Right.
Because then it'll be every year, right?
Right.
Yeah.
Right. Dr. Chiu, if a country which is high vaccination and screening rates, how fast do you think we're going to be able to reduce this cancer by? You mentioned that briefly just now, how you've already seeing it, come to pass.
Okay, so Malaysia, because we started the vaccination on a national program, right? So we started 2010.
Yep.
And they started collecting information in 2018, I say. And they actually already saw, they did cross-sectional study. They actually saw a difference, okay, in the high-risk HPV, okay? Right. In the ones that we vaccinated, okay? And then they compared again later, and again, massive drop. Okay, so we have our data for cancer is not as robust as other countries. Okay, but they've already seen a drop in HPV. If we see a drop in HPV, you're going to see a drop in cancer.
Cervical cancer. I want to ask you something controversial, because you said before the girl could have never had genital contact with anyone except one boy, but the boy is already HPV positive. That's how the girl gets infected. Would you say it's legit to also get our sons
to vaccinate?
To vaccinate? to eradicate
yeah.
cervical cancer?
Actually, yes. Actually, internationally, the recommendation is to vaccinate both boys and girls. Okay, if you can through vaccination, if you can eliminate cervical cancer by the year 2030, if you vaccinate both boys and girls, you will halve the time. Okay, all right. And the boys need protecting too because they have same-sex relationship and they get anal cancer, they get penile cancer. Okay.
Right. From HPV virus.
Correct. Yeah. Okay. I visited an African country where the highest killer is cervical cancer. Okay. And then in the top 10 in the country, you have cervical cancer, you have vulval cancer, you have penile cancer, and you have anal cancer. Okay. And these other three never appear in the top 10 in any other countries, you know?
Right.
But only in countries where HPV is a major issue.
I see.
Yeah. So in those countries, everyone worldwide is doing HPV vaccination now.
Right.
Okay, right? Because there is that WHO has got a aim that we will get rid of cervical cancer as a health problem. Right. So every country has a responsibility to start vaccination. Okay, every country has a program to screen. Okay, and then to offer treatment. Okay, and they don't just sort of say, "Oh, you have to do." They follow it up. Okay, so there's this IRC, it's an international agency. They are actually following up what each country is doing and how well each country is doing. Okay, and Malaysia is very much up there. You know, yeah.
Malaysia boleh.
Yes. You know, we're already there with the vaccination. Okay, we actually won awards. You know, back in 2012.
Yeah,
I think Malaysia won an award for having the best national vaccination program.
Which means that the missing component now for us would be the screening to pair it up with the vaccination programs. The government's offered a robust vaccination program. Yeah. It's up to the individuals now to screen.
Correct.
And it's a simple HPV test that women could do for themselves.
Indeed.
I think that's where we get to.
Yeah.
Yes.
Yeah.
Let's finish with this one last question, Dr. Chew. After everything you've seen and done as a gynae cancer surgeon, what's one belief or approach you've had to reset in the course of your career in working in this field that has changed the way you care for women?
When you're young and you're eager and you want to eliminate cancer, when somebody appears with cancer, you almost become angry, okay? And then there's a little bit of blame as to why you didn't do things, okay? But now I sit back and sort of say, okay, you're here, right? You didn't go for screening, so you tell your family you go for screening, okay? But then you're here, so let me help you where you are now. Okay, I think that's how I've changed my attitude very much. Okay, but it's difficult. You know, I like teaching. I like telling patients, you know, all about cervical cancer. I spend ages talking to them about HPV screening and how it's going to help prevent the cancer, right? And then they say, okay, come, let's go do the pap smear. After all, but else is a branding, right? Right. Because they cannot remember HPV testing. Okay, but they do know I'm talking about HPV testing. Okay. But I think very much so. If I can't prevent the cancer in this woman, then I would say, okay, you go tell your friends. Okay, this is what we can do.
And it's exactly what we're doing today, Dr. Chew. We are talking about HPV testing, and I'm confident that after today's episode, there'll be more women out here in Malaysia that has heard about HPV testing.
Good.
Thank you so much for your time, Dr. Chew, and joining me today. If today's conversation has sparked some thoughts in your head, share it with us by leaving some comments below. We want to keep having honest conversations like today for you.
This episode reflects personal views and recollections at the time of filming. Its content is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare practitioner to address the concerns you have.